Hello, good evening, everyone. Hi there. All right. So welcome to this evening's long-term care family call. Just to begin, we are welcoming everyone. Today is July 22nd. The call this evening will be running from 7 p.m. to 8 p.m. as normal. We like to keep it within an hour, so we will have time at the end of the update to have a question period as always. With us tonight, we have our Director of Long-Term Care, Jennifer Cornell, and we also have our Long-Term Care Clinical Specialist, Dana Lynch. She will be here answering some of the questions this evening as well. Just a reminder to everyone that all questions will be funneled through our Q&A feature on Zoom. If you have questions, please feel free to use the feature located at the bottom of your screen if you have a laptop or desktop. And if you are watching this from your cell phone tonight, it can be found at the top of your screen. All right, I do have one other item that we need to read through before we get started. So I will be sharing my screen before I pass it on to Jen. Okay. Okay, everyone can see that, the disclaimer. So today is Thursday, July 22nd, 2021. This video discussion matters related to residents of long-term care homes operated by the County of Grey during the COVID-19 pandemic. Please feel free to share this video with others in the Grey County community. If you have family members in a long-term care home not operated by Grey County, please contact that home if you have questions or concerns about their care. The video also will be found on YouTube, so you can visit our Grey County YouTube page if you'd like to view this video or any of our past long-term care call videos. All right. So I will now be passing it on to Jennifer Cornell, our Director of Long-Term Care.
Great. Thanks, Olivia. Good evening, everyone. So I'm just going to grab my notes to give you all a quick update. So thanks for joining us. Olivia did the introduction, so I'll just get right to it. We met last virtually on July 7th, so not very long ago. Since then, there has been some significant changes in the directives. And sorry, I've got my computer's telling me to do things here. So there have been some changes, and so I just wanted to connect and give you an update. It is a brief update, and we'll have some time for questions at the end. So all of our residents are fully vaccinated, have received both doses of vaccine. The usual update that I like to provide, staff and DCPs are also working through the vaccination process. All three homes are between 70 and 75% of fully vaccinated staff. And we are working with public health to continue to have access to vaccine and supply vaccine, and are working to encourage all staff to have confidence in taking their vaccination. As of today, there are no long-term care homes in outbreak in Grey Bruce. However, we are a hotspot, a Delta hotspot in the province. So the purpose of the call tonight is to just give you an update on the changes to the directive with the release of the Step 3 guidelines. So just to give you a quick overview of where we're at right now, we continue to do active screening for every person who comes into the building. Staff are only working in one long-term care facility unless they are fully immunized. Rapid antigen testing continues, and there's going to be some changes to that. All staff and visitors in the home are wearing surgical masks at all times. Plans are in place for all three homes to quickly isolate residents and to move into full outbreak protocols if necessary. And we continue to monitor and ensure that we have a good supply of personal protective equipment. On July 14th, the Ministry of Long-Term Care released the changes in the directives to move into Step 3 of the Provincial Road to Recovery Plan. The changes that we can look forward to relax many of the restrictions that support increased opportunities for socialization and visiting. We are working on how to operationalize these relaxation of restrictions while still managing the risk of transmission of infectious disease. We anticipate that fully vaccinated visitors will be able to visit in residence rooms, while partially or unvaccinated visitors will continue to require testing and will visit in designated spaces. We will continue with masking, hand washing, and cleaning strategies for the foreseeable future. I don't see us losing the masks in long-term care anytime soon. So that's the future that we can look forward to. Having said all of that, Grey Bruce continues to be an identified hotspot. Unfortunately, the Delta variant has proven to be far more contagious. And because of this local situation, Grey Bruce Public Health recommended that all 19 long-term care homes follow a modified step 3 approach. So our 3 care communities are following public health's request, and will continue with the following. Up to 10 people at a time can come for an outdoor visit with the residents, and masks are still required. All residents may have up to 2 general visitors and 2 caregivers at a time. Eyewear protection will continue for team members, and partially or non-immunized indoor visitors whenever distance can't be maintained. And the goal around eye protection is 80% vaccine rate. So once we've achieved 80% vaccine rate or higher, then we will be able to eliminate the eye protection. Short-term social and temporary leaves remain for allowed for fully immunized residents, and resident daily screening will be reduced to once a day. Partially and non-immunized individuals will continue to follow surveillance testing 2 to 3 times a week. And all of this came into effect on July 19th. Also on July 19th, fully immunized individuals, so that's staff, designated care partners, were exempt from surveillance testing. Just a reminder that fully immunized is 2 doses plus 14 days, and proof of immunization is now required. And in a couple of our communications, we added some links and information on how to access that proof of immunization. And if you're having trouble, please feel free to bring your health card with you. And we have systems in place to be able to support looking that information up for you. The Color It Connect program continues to offer virtual, window, indoor, and outdoor visits, and can be accessed through the website. And just a reminder not to visit if you're feeling unwell at all. I wanted to just do a little bit of a reminder about food and drink. So for right now, you are able to bring food or drink for your loved one, but not yet eat together. That is something we can look forward to when we get the local situation numbers lower. We talked a little bit about temporary absences. And then just a reminder that the masking, good hand hygiene is really important. And a reminder that the mask goes over your nose. So it doesn't hang from our ear or under our chin, it has to go over the nose. And this is something that we try to notice for our colleagues and for our visitors as well. I heard on the news this morning, so I'm just hearing what you would have heard on the news from an epidemiologist, that the pandemic, from her perspective, has 2 endings. And so I'm probably oversimplifying, and I am not in any way an epidemiologist. What I heard was that in one scenario, the COVID virus fizzles out, it disappears in a way like SARS did. Or alternatively, it will be more like influenza, and we find a way to live with COVID. In that scenario, and I think that's the more likely scenario, I imagine that we shift our focus from restrictions to prevention. And so the prevention piece is the vaccinations and the screening and ensuring that we don't come to work or go out into congregate settings like grocery stores and public spaces if we're feeling sick. Screening and early identification. So when we have symptoms, we're getting tested, we're monitoring our residents for symptoms. And then quick isolation and containment with the goal of limiting the transmission to as few people as possible. And so I cannot tell the future, but I do imagine that if it is like influenza and it's something that we need to just prepare to live with, then that's where our risk management strategies need to be, is in that prevention and containment. And like influenza, from time to time, we will have staff member, resident, family member become sick. And so then it's important that we manage that appropriately. So that's really the crux of the update today. We expect to hear more from the Grey Goose Public Health into next week as to when we would be moving out of these modified step 3 and into the full step 3. And when we get that information, as always, we will share it out in a newsletter update, and then we can do a call if we need to, see where we're at. Before we get to any questions, I would like to get some feedback from those of you that are on the call. And Olivia is going to help us with launching a poll. So we have 2 poll questions. And I don't know, did you want to give the instructions, Olivia? And I will get this eyelash out of my eye that started just at the beginning of my update.
Yes, of course. Just also
Okay, that would be great.
this fan that is beside me. Okay.
Great, thanks.
So we do have 2 poll questions that I will be launching. I am unsure if they will disappear on me as soon as I launch it, if everyone else will be able to see it but me. So I'm just going to read it first. We do have a few people that are calling in tonight, so I'm not sure if you'll be able to fully participate. But if you still wish to participate in a different way, you can always email communications@grey.ca with questions or your answer to these poll questions. It will be directed to the appropriate individual, whether it ends up being Jennifer Cornell, as you were hearing her speak, or it might be another person in our long-term care facilities. So this first poll question has to do with meeting frequency for COVID-19 updates. So these kinds of meetings. The question simply is, how often would you like to meet? The answers that we have that you can choose from are listed as when there is new update releases, once a month, every 2 months, or every 3 months. So I will launch this poll question, and I would like to know, oh, there we go. We are getting information coming through. So I'll leave this open for 30 seconds-ish until I see that the majority of people have answered. And we do have a number, as I said again, of people just calling in, so I might factor in those numbers. Okay, I'll give it about 10, 15 more seconds. Okay, I'm going to end the poll now. Let's see. And we can share the results. I am first going to ask both Jennifer or Dana if they would like the results shared. We don't have individuals. Yes, you'd like? Okay, so sharing the results. The majority of people are saying that how often would you like to meet? When there is a new update released, that is the majority. We also have individuals saying once a month. So it seems as though it has to do with current updates to either provincial information coming about or maybe the Grey Bruce Public Health updating us. Okay.
Great. Thanks everyone for that.
All right, and then I'm going to be stopping sharing this one. So we do have one other question for you, and I'll read it first and then we'll launch it. So this has to do with ongoing communications. Would you like to continue virtual style meetings for non-COVID-19 issues having to do with redevelopment, BSTU, or etc.? So there are two options. You can say yes, or you can say no to this. I will be launching it now. Okay, I'll give you about 10 or 15 more seconds. Okay. So I'll share the results now. It looks like the majority, very much so, has said yes, they would like to continue virtual style meetings for non-COVID-19 issues. Okay.
Great. Thanks so much for doing that, Olivia, and thanks everyone for your votes for that. We may send that out with a MailChimp newsletter as well to get some broad feedback from people. But I have really felt that that our efforts to improve communication have been positive, and so we don't want to lose steam on that, and just wanted to check in with everyone. And for anybody that's trying to keep up, I did get the eyelash out of my eye. Thank you. So
very good.
Yeah, I don't know. That was a new thing that I hadn't anticipated preparing for. So a reminder, type your questions in if you have any. We'll just give it a minute or two. I don't see any questions there.
They will, yes, I'll just remind anyone because we had probably a few people come in after we started. So as always, we take questions in the Q&A chat. It might take a couple minutes for people to type out what they wish to say. So we'll give people a little bit of time, but I'll keep monitoring it. Okay.
So we'll give people a couple of minutes, but if there are no questions, that's okay. If there's any specific individual issues or challenges or questions, as always, please don't hesitate to reach out. Olivia gave the Grey County email, and our communications email, and my email is also always included in the newsletter updates. So feel free to do that. It also helps me to get a sense that that maybe we're doing an okay job at communicating via the newsletter. So so that's good. I do see one there. Yeah.
Yes, we do have a question, so I'll read it out first. Do new residents coming into, long-term care still need to be isolated for 14 days, even with both vaccinations?
That's a great question. I'm wondering if Dana can maybe take that one.
Yeah, I'm happy to answer it. So for new residents coming into our care community, we're really fortunate. For those that are doubly vaccinated, there is a very short period of an isolation coming in. They've obtained depending if they're coming from hospital or community, we've obtained a PCR test and we're getting our results within 24 hours. So generally the isolation is less than 24 hours. And we expect new directives coming in shortly that may even eliminate that. So they may be hot off the press. They said tomorrow. So where we are today may not be where we are tomorrow. But at the present time, it's not 14 days if they have both vaccines plus the 14 days. Remember, the fully vaccinated. So if that's the case, it's just after a negative PCR for COVID, and then they'll be able to get comfortable in their new home.
Thank you very much for answering that. Okay.
It must be a Friday if there's new directives coming.
All right. So at the moment, we don't have any more questions. We can wait we have another one. Okay. So now that we can take our loved ones out for day trips, can we have lunch made for them as our parent needs blender styles of food?
Sure. So my recommendation would be to reach out to whoever your contact is at the care community, whether it's the program manager or the nutrition manager or one of the nursing staff, whoever you regularly connect with, and they will guide you in the right direction.
Okay, we have another question. Do new DCPs have to do the computer courses? My sister went in to visit my mother, and they had her do paperwork and said they will provide her with a photo badge. Is she a DCP now?
So we can do some follow-up. So yes, the short answer is yes. DCPs need to follow the same process now as they did during the beginning of the program. There are two options. So there's the computer course or there's the booklet. So perhaps she worked through the courses in paper version. That's one option. And I'm glad that you asked that question. We're really looking at what does the future of the designated care partner look like, and how might it evolve to a care partner program that, as we move into more normal living and long-term care, residents won't need to designate someone necessarily in terms of a visiting solution. So we're looking at how it evolves, and I know that some people are using the DCP program as an opportunity to be at the bedside, and totally appreciate that. I'm hopeful that as the numbers reduce in Grey Bruce and we move fully into step 3, that we can review what that distinction is between designated, like a care partner, part of the care team, and someone who's a regular visitor, but they're not actively involved in the resident's care. And so we'll work through that with you, with the DCPs, with the residents, to sort out what that looks like. So that was a long answer, but I appreciate the opportunity to talk a little bit more about the Designated Care Partner program. We're coming up a year from that program, and I'm not sure if people realize locally that those of you that would have been involved in the beginning and have joined on as DCPs as the months have gone on are really, the work that you saw at that program was really pioneering in long-term care, and really made it possible for family members and caregivers to provide that bedside support safely across the province. And I can't thank you enough for working with us through that really amazing program. And I see it having amazing opportunities into the future.
Thank you very much for answering that in depth. So we have another question. Do you have any insight on more long-term care beds opening up?
Not really, other than there are new developments and redevelopments happening locally in Grey Bruce. I'm not sure if there's a place to look to see in one place, but there are redevelopments happening across various communities in Grey Bruce, including Rockwood Terrace in Durham. And it's redeveloping from 100 beds to 128 beds, and Grey Gables in Markdale, 66 to 128. So, and then there are other redevelopments. I know People Care is doing a redevelopment in Southbridge, so People Care in Meaford and Southbridge in Owen Sound, and I've heard some discussions about Thornbury. So the province is moving forward with opening more spaces for long-term care residents.
Okay, we have another question. I have 2 loved ones in the home. They didn't specify which one, that's okay. Can I take them out for an outing together?
So I'm going to say yes, that I think absolutely, but I think what's important for me to say is you need to check in with the home and just, work through all of that risk management scenario. Just look at all the different things. What is it you're hoping to do? Are they fully vaccinated? That kind of thing. But I'm sure we can find some path to yes.
Okay, we do have another, let's just call it a statement, and it's a very nice note. So it reads as follows. This is not a question. I just wanted to say a big thank you to you, Jennifer, and your staff and support people. Also a thank you to Rockwood Terrace for keeping the residents safe as well as the DCPs. Keep up the great work. So that was a lovely comment that was left.
Thanks so much. And it's hard to believe that we're into like 16, 17 months. And that's why I wanted to bring up what does the future look like? Because I think as much as we'd all wish for it just to wake up one morning and it isn't a thing anymore, I don't think that's realistic. And we need to figure out how to provide lives worth living, that are thriving, and communities that are thriving and that are social and that are home. And we need to find a way to do that and also live with COVID in our world. So I appreciate your acknowledgement, and you and the residents and the teams have just done an amazing job for an amazing amount of days, weeks, and months. And we're getting there. I know we will figure it out, and it will be fun. It'll be good. It'll be joyful, and we'll find a way.
Okay, so we do have another full question. Are all the residents eating in the dining room together yet?
Jenna, for all 3 homes, I know they've moved back to more congregate, more normal dining. I think the tables are still spaced. Sorry, I'll let you know.
We were talking with the province also to support us in getting there. And I would say we're on the path to get there indeed. But we still are taking a look, particularly because we're in a modified step 3 in Grey Bruce, that we're not there yet, but we are committed to moving that way. So many of our residents are in the dining room. What we have talked with the province about too is increasing the number of people around the table, but it's still ensuring that there's that social distancing capacity. But we are absolutely heading that way, just not quite there yet. But quite a large proportion are in the dining room. A lot of socializing is happening in addition to dining. It's really becoming quite a lively place again, and it's good to see. But indeed, dining is one in which we are doing it in a cautious way.
Thank you very much for answering that, Dana. Currently, we have no more questions in the Q&A. However, if someone wishes to still ask a question, we still have lots of time. We will wait to see if anyone's typing anything at the moment.
Sure. And Olivia, I noticed that someone raised their hand. So I wonder
okay. Yes, I do see that too.
Yeah. So if in fact that person wishes to say something, I think that's okay. And maybe it was an accidental hand raising, but so if I click allow to talk, Is that what I should put?
If you would like to have individuals speak, they can. Obviously, we would prefer it if it was in the Q&A, but if this is more of a, it's
I'm
easier for
navigating
them
this
to
into-
speak.
to
Yeah, that
uncharted
is,
waters. And
that
so
is
it is
okay.
recorded, and so I'm going to click it and see in that way.
Sure.
There we go. And so if in fact you'd like to say something, you should now be able to do that. Trua Scales.
And if it was just an accident, we will take a moment and pause. That's okay.
Okay.
Okay. So there we go. And okay, so we still have a little bit of time if anyone is asking any questions in the Q&A. If no one is and we don't see any more, we could potentially be ending the call fairly early. Obviously, we have the space from 7 to 8 always lined up every time for our long-term care family calls. But if we end early, that is up to our director to let us know.
All right. So I think it's a beautiful summer day. And thank you so much for being engaged and for joining the call and participating in our polls and asking questions. Summer is short in Ontario, so something that we've been doing in Grey County Long-Term Care is talking about honoring vacation requests and honoring vacation and taking some time to rest. So I encourage you all to do that as well. Spend some time resting in the next 6 weeks. So I do see one last question. So the restorative care,
I'm just going to
behavioral support. Yeah.
I'm just going to read it out loud just in case people are listening for like the calls. Okay. So the question is, at Grey Gables, is the behavior wing ready for residents yet? You can clarify.
Thank you. Sorry. Oh, yeah. So it's the behavioral support transition unit, and it's getting there, but not quite. So there is lots of work going on behind the scenes. Right now, they're just wrapping up the recruitment process to designate the dedicated team that will be providing the care and support on that home area. And so we're getting there, but not quite ready for residents yet.
Okay, thank you for answering that question.
Okay, so I'm going to say thank you to everyone so much. If you did want to ask something and you didn't have the chance, please feel free to send that email, reach out. And when we hear an update next week around shifting out of the modified and into the full, we will let you know as soon as we hear something and what that means to you in terms of changes for visiting or access or resident experience. And we will keep you posted. So thank you so much and have a wonderful evening.
Have a wonderful evening, everyone. Bye. I'm going to be ending the call now.